Okay, well, it's after 12 o'clock now, so I think we'll get started. So welcome to the Q Community Evaluation Special Interest Group webinar on sharing results of your improvement work. I'm Emma Gibbard. I'm the Evaluation Special Interest Group convener, but I'm also happen to be Research Impact Manager at the University of Bath. And I am delighted that today we are joined by Helen Crisp, Editor-in-Chief at the BMJ Open Quality and Q Community Evaluation Special Interest Group member and independent consultant, who's going to share her insights, experience and expertise around publishing your quality improvement work. So covering things around why you might want to publish, where to publish and how to write for publication, but also bringing on some wider discussion around communication. Just before we get started, I'm just going to go over how the webinar is going to work and do a bit of housekeeping. So we've got really great sign up today. We've got over 55 people signed up. At the moment we've got about 20 people who have joined us and hopefully more people will dial in. So we don't quite have a chance to do a round of introductions. So if you can use the chat function, which is if you go to the bottom bar of your screen and you're joining us online, there's a chat box. Please introduce yourself there. If you're joining us by phone, you don't have that option, unfortunately, but I will try and capture who you are. How the webinar is going to work. So Helen's going to do a presentation for about 40 minutes. During this time, there will be a few pauses for questions, at which point, please do ask your question. You can use the chat function. You can also ask in person, whichever is your preference. And I will monitor the chat box to see who's asking questions and I can also ask those questions on your behalf if that's helpful. We will then have about 20 minutes again to do some further Q&A, so you'll get an opportunity to ask any additional questions that have come up throughout the presentation. In terms of, hi Tim, in terms of housekeeping, can I ask that during the call, the presentation, sorry, you put yourself onto mute, especially if you are in an open plan office or you're at risk of background noise, but please obviously do take that off when you when it comes to question and answer, or if you have a question to ask during pauses. Has everyone found the mute function? It looks like everyone is on mute. That's brilliant, thank you so much. Let me just check what else I need to do. You've all found the chat function by the looks of it, which is fantastic. Hello everyone. I'm going to try and monitor questions, listen to the presentation and deal with any technical issues that come up. If you do get a technical issue, in the chat function you can select everyone or you can just select me. If I can ask that you just select me and then let me know what your technical issue is, I can make sure that that's dealt with. But do bear with me because I will be monitoring 3 different elements and trying to keep on top of everything. We are recording the presentation. I think it's set to record. So that we have a copy. If you do not want your questions, so obviously because we're going to have pauses in the presentation, if you do not want your questions or your contributions included in that recording, please just let me know and we will remove it. We can edit it out. And then the recording and the presentation will be shared on the Q Community Evaluation Special Interest Group space, so you'll be able to access the slides and additional information through that. Okay, so are there any questions before we get started?
Emma, it's
yes,
Matthew. Should I actually start the recording when you actually start?
I think it's already set up to record. That's
okay.
But yes,
I didn't know whether you wanted the beginning and the end and stuff.
Yeah, could you press record just in case it's not then, Matthew? So Matthew's kindly joined us from Q Community and is Zoom webinar extraordinaire and will hopefully help me through this Zoom. I realise it's some people's first Zooms, so do let me know if you have any technical issues, and I think Matthew again can help me with that. Any other questions before we get started? Can everyone see the slides and hear? Yeah. Okay, so if we can put ourselves onto mute, I am delighted to introduce Helen Crisp, as I said, Editor-in-Chief at BMJ Open Quality. I will leave Helen to introduce herself and hand over. Thank you, Helen.
Okay. Oh, I was just putting that up because it was there. Yes, so currently Editor-in-Chief at BMJ Open Quality. I've been doing that for just over a year now, and running that alongside doing independent consultancy. Prior to that, I used to work at the Health Foundation, where I was Assistant Director of Research and therefore managed the grants programme for research grants, mainly focused on patient safety, quality improvement methods and person-centred care. And before I joined the Health Foundation, I'd worked in quality improvement programmes, a programme that started in the King's Fund, and it was developing quality standards for healthcare services and then doing helping people apply those and other quality programs. So I've been working around quality improvement for quite a while, but I think it's true to say that taking on the role of Editor-in-Chief at BMJ Open Quality has really opened my eyes to the whole world of publishing work, and realizing that not everybody is very confident about this or really understands how it works. So I think it's a great opportunity to have this webinar to look into that a little bit further. So this is what we're going to look at. Why publish? You know, why bother? We're all really busy. You know, does the world need more research papers? And I think in this field, I think I'd say yes. I think we do need more papers to come out, because there's a lot of work that really gets lost and is never known about. Results aren't shared among the wider community with other people doing similar work, and so that leads to some, you know, duplication and really wasted effort as people keep trying the same thing. So I think, you know, we'll be looking at that. Also thinking about where to publish, what sort of journal, what are the different a little bit about different types of journal, also thinking beyond the academic journals. As you're getting ready to write, some tips on how to write for publication, and particularly focusing on a well-structured quality improvement report, as I think that is what most people will be in a way starting to sort of cut their teeth in publishing with, doing that sort of work. And then, as I say, looking a little bit broader than the sort of academic or online journal, to think where else and what other routes to share improvement work, because publishing is just one quite narrow avenue, and there's lots of other ways to share our work, and we really need to think of those as well to just get maximum benefit from the work we're doing. So why is publication an important issue? Well, because we would like to think that quality improvement is evidence-based, and that people are learning from what's going on across the field. And unless we get the benefit of learning from what other people have done, what's been found to work, you know, as I say, we just keep duplicating things. It's particularly helpful to publish if you feel you're doing something where you've tried some new approaches, and I think we've seen a lot of really good work starting to be published around approaches such as patient and public involvement in QI, but we really want to see more of that. That's still very little used, real untapped resource, and we need to get publications out about these new approaches, new ideas, help spread the successful interventions, and as I've said, really prevent wasted effort where people go with what seems like a good idea, but if other people had published and if people looked at the research evidence, it would be clear that some things which seem like an obviously good idea actually have unintended consequences and may not achieve the results that people hope. So there's a lot of really good reasons to think about getting this learning out there, and that too much of it is just stays shut in with the teams who've done the work and nobody else is going to learn about it. And I'd really like to bring in the 3 Ps, power, policy and politics, because when we don't share the work, as I say, it remains hidden, and so we're not building the evidence base which can persuade other people of the need to do improvement and to learn about what works. Published work can have an influence on policy. I mean, I know people will, quite cynical about the fact that, much policy is not based on evidence, but then if we don't get the evidence out there, it definitely won't be based on evidence. And I think we've seen some key areas where the publication of quality improvement work really has influenced policy. And I was at a presentation yesterday where I was reminded of the work done around quality improvement for children's cardiac services. And that's had a tremendous influence on national policy and how national audit data is used and so on. So it can be really influential in forming policy. And also more locally, for you as quality improvers, thinking about politics with a small p, in terms of your the politics of your organisation and your ability as an influencer, publishing is incredibly powerful to increase your credibility and to show that other people are interested and have respect for the work that you've done, and the way that you can then, you know, show that you are contributing to building the evidence base and that the resources and the effort that you're putting in is really worthwhile, and again very persuasive to try to get others to join you in that work. And I think one of the most important things is this whole issue of avoiding wheel reinvention. It is a real problem in QI work. We see it time and time again, that people just start doing something rather than stopping and looking and taking stock. We're tremendously keen on local innovation and not nearly as keen on adoption and adaptation. So, you know, would really like to encourage people to review what's done elsewhere, but again, if we're encouraging people to review what's been done elsewhere, they need to be able to access that, to have the information and to be able to review it so that we don't waste the time just developing things from scratch. I mean, for example, a lot of the papers that we publish in BMJ Open Quality, if people have developed a checklist or an information leaflet for patients, they will quite often attach these as appendices to their paper. And, you know, all these resources are there and they don't need to be developed from scratch everywhere. You can just pick up what somebody else has done and it's so much quicker to refine and adapt. And I also think that putting some effort into publication and dissemination is an important part of the recognition and celebration of the work that you are doing with your teams and your supporters and the patients and carers who are working with you, because it is a way that, you know, literally in black and white recognises contributions and efforts. It's there as a record to remind people of what you've achieved, the change that has come about. It helps people know, again, reminds people in the team. And again, it's not, whilst publishing in a journal is one way of doing this, we will look at other things, really low-key things like putting up a poster in the department. The sort of write-up you do for a newsletter are also really valid ways of just ensuring that there's this recognition and celebration of the work that's being done. Thinking now about publishing, do need to think about where to publish and the sort of journals and outlets that will be interested in your work. And a lot of quality improvement work is not about basic science, and therefore it doesn't meet the criteria for new and original work with, you know, very strong data to support it that would be required for clinical research journal. QI reports, you know, this is not discovery science, but I think that's fine. We need to celebrate this work for what it is. It's about implementation of ideas. And if we're thinking about publishing the work with the intention of letting people know what we've done, it's really important that that has to then be the focus of the work, that it's about other people understanding what your intervention was, how you developed it, how you overcame challenges. So it is a different sort of paper altogether, you know, and it is unashamedly not chemistry. So we'll have a look at that a bit later on, about how we make sure that we're really focusing on what's going to be important to other quality improvers, which is who I'm seeing as really the main audience that we want to get to here. So when you're thinking about the sort of journal, it is important to think of the focus of that journal. Impact factor is sort of right here at the top of the list, which actually I should have moved it further down, because I think that's, unless you are a a professional academic and that's your main job, I don't think the impact factor is really something that's that important. You need to know who reads the journal that you're writing in, rather than sort of thinking about the esoteric impact factor. So that's where the reach is really important. You know, what's the circulation like? Who is that audience? Does it have open access? Because again, if things are behind a firewall, then you have to be in an academic institution to be able to read the paper. And so I think for a lot of this work, we're really, open access really is the way to go. I'm not just saying that because I edit an open access journal. I mean, there is a reason for that because of what that journal's trying to do. The processing time needs to be taken into consideration because it does take a while. You're unlikely to get something out in a journal, in an academic type journal, in less than about, I would say 3 months would probably be the minimum, and often it takes a lot longer than that with the peer review process. So if you're looking to publish something that you then want to influence a business case or applying for funding or doing some spread work, then an academic journal is you know, the timeline is probably not going to suit that because you can't hurry it. Do think about the rejection rate, because some, you know, things like the BMJ and the Lancet, well, they're not really ideal venues for quality improvement work unless it's sort of very innovative and you've got some really sort of quite dramatic findings to share, but you'll be really fierce competition. So again, I mean, aim high, but don't be surprised, you know, if your paper is not accepted, because they can only publish a very, very small, I think it's something like 4% for those top journals. Do look at what the journal's published before. So that's not just its focus and its sort of scope, but also if the journal has already published several papers on your theme in its last few issues, that they're unlikely to want something again so soon. So, you know, think about, have they done this to death, or if it's something they're really interested in, then it probably is worth going to something that has published on this area before. And really think about how is the journal helping to make the most of your research and your improvement work, and are they going to help you promote it by tweeting it? What sort of additional help can they give you to really get this out there? And one of the things to be aware of is you may have received emails from journals that you've never heard of inviting you to submit a paper. And these are what's called predatory journals, and they're not really very highly regarded. The work is not likely to be peer reviewed, and really, to be honest, they are just money-making ventures, charging people to publish their work, but not having any sort of audience or reach that's really helping to publicize the work. So those are some of the things to think about when we're thinking about a journal. Now, I am going to mention a couple of BMJ journals, you know, and to declare my interest in that, you know, I am paid an honorarium to do editing for the BMJ group. But I mention the journals because I think they really are the key journals in the field. So BMJ Quality and Safety is, I think, true to say, you know, the leading journal now in the quality improvement, patient safety arena, and that's had a lot of input over the last few years to really ensure that it is the leading edge journal, that they are publishing the work by teams doing very innovative work, by some of the lead researchers. So that's great. Of course, that's now made it very much more competitive to get into BMJ Quality and Safety, because they have now got an acceptance rate of about 12%, which obviously means, you know, do the math, 88% of what is submitted there they can't accept, because they are now looking to publish work that is very much, that is new research, that's original methodology, that is sort of deep insight into quality improvement work. So it's not a venue for a straight quality improvement report, which is where we come to BMJ Open Quality, and, you know, cards on the table. Yes, this is the journal that I edit. My interest in taking on that editorship was that this is a journal focused on quality improvement with a role to publish quality improvement reports, and therefore be a venue where we share the, if you like, the bread and butter quality improvement work that people are doing around the world. So this is fully open access and online only. So there's no print version here. It's all online. All of the articles are open access, so anybody with an internet connection can get online and read any of the work there. We have acceptance rate currently of 52%. I think that will inevitably have to go down a little bit because we are now getting more papers submitted. I mean, this is quite a new journal. It's about 3 years old now. So it takes a while for journals really to get going and to get known in the field. But we have a different role. I wouldn't say we have lower criteria. We have high criteria for the types of work that we're publishing, but it is a venue where people doing the work can put in their reports and have a reasonable chance, if that is well written and clearly presents the points, that you can get that published. So this is what it looks like when you go online. You can see, this is a screenshot from a few months ago now, that it always has the latest articles and the most read articles, and then you can go back to the archive and things are then in there, published by date back in the archive. But it also, the website has got a good search function. So as well as publishing your QI work, I would say, have a look, have a search, read around when you're thinking of starting a new initiative. And, I think this is one of the places to have a look to see what else has been done. And the search function works quite well to bring up papers that will be in your, if you're trying a particular approach or in a particular setting, you should be able to find what's been published before in BMJ Open Quality. So as well as the quality improvement report, which comes at the bottom of the list there, I don't know why, because it's our main type of feature, we do also publish original research, reviews. I'm really interested to get a few more papers on methodology around quality improvement and how people are using different methods, and your reflections and experiences of using different methods, and your tips about how to do particular quality improvement approaches. That would be great. The other thing that I'm keen to get more of, and I think it's, again, a good starting point, is a short report where, this needs to be really punchy, but if you've got some tip to pass on, or some quite sort of startling finding, or I think some of the ones I really like are where people have done a quality improvement project that was really, it almost didn't need a project. They just thought about something that needed improving and took the steps to improve it, and that was it. And so there was a great one where they'd realized that they were getting lots of redundant test requests through the automated process, the automated test ordering process, and literally just reviewed the default settings. And by reviewing the default settings, we're able to cut these unnecessary tests, cut the time for patients, cut the expense, and that didn't need a big quality improvement report, but was a super short report saying to people, hey, just do this, just try checking some of these default settings and see what happens. Really keen to hear about how your training and education programs are going. We really want to know about impact on learners, how their knowledge improved, how they were able to apply it in practice. We can't accept papers which just say that people were satisfied with the training. We need to have some impact on that. And then our main article type is the quality improvement report, which I'll go into in a bit more detail, because this is really our publishing niche, if you like, and I would see it as in many ways the main role of the journal, because it's one of the only places where you can get useful QI reports published online in a journal. I'm looking for them to be useful, to really pass on the learning to other quality improvers, and they do need to be well written, comprehensive, following a coherent structure, because we're not, as I say, we're not setting low criteria for publishing. It needs to be well written work. It's just a different type of work that we can accept that other journals don't. All our papers are peer reviewed, and I should go on and explain a bit about the peer review process a bit later on. One thing to be aware of is because it's open access, the business model for this type of publishing is that then it is the authors who pay the publishing costs. Obviously, in the traditional model, the journal was funded by people paying subscriptions. That's what a lot of clinical journals are still subscription-based model. But in this model, because it's open access, we don't have subscribers who pay for the content. The articles are available to everybody, but then we have to fund it somehow, and therefore the authors pay an article publishing charge. And I know that this is a barrier for people who don't have access to research funding or other types of funding that would cover this. However, the amazingly good news is that part of the Q community offer is that your APC is covered if you are a Q member. And, you know, I think people really need to take advantage of this. That's, you know, that's £1,000. And you can tell your organisation that's £1,000 of funding, effectively in kind, that you are bringing in by being a Q member, that you can get this work published without needing your organisation to find those funds. And I think that's an important barrier, which people who, you know, who otherwise wouldn't be able to think about this sort of publishing, you know, that is no longer an excuse. Now, sort of get in here and let's start getting your papers. You do need to make sure you have that code ready when you submit your article. You can't then sort of go back and put it in when the article's been accepted. You have to be ready with that when you submit. I think I'm going to stop there and pause to see if there are other questions, particularly about the journals, about open quality, or, you know, why to publish at this point.
Oh, hang on, sorry. Oh, just unmuting myself. Thank you, Helen. That's fantastic. We've had a couple of questions come in around open access, one of which you've started to address around the open access costs and some solutions to that. So that's a fantastic offer from the Health Foundation. But that question came in from Jacinta Tan. Jacinta, did that answer your question, or do you have any other further questions around the cost of open access being a barrier? Okay, okay, no, fantastic news about the APC and Health Foundation. So I think that's covered from the chat function. Lisa Ridlington reminded us that we have Open Athens. So if you work in an NHS institution, you can sign up for your Open Athens account. And I've included a link in the chat group. So thank you for that, Lisa.
That's great, yes.
And a question from Matthew around the role of Life QI in relation to BMJ Open Quality. Matthew, do you want to say any more about that?
Well, I suppose it's just that Q members so often are wanting to find out, you know, to stop the reinventing of the wheel and find out who else is working on a particular topic, you know, whether it's the project or the people themselves. And I guess publications are one way to do that, but that Life QI platform that has many thousands of projects on it is another way. And I just wondered how they relate and what you see the role of something like Life QI in relation to the publication route.
Yes, thanks for raising that, Matthew. I mean, I would say there's no formal relationship, but I guess Life QI, as you say, gives current information on what people are working on, which is really great. And I think in terms of people making contacts and really wanting to discuss the work, then I think that is a much better platform than publishing. Publishing enables people to sort of share their results and in a way that's more of a record once something has been completed. So I think it is a different role, and I think, you know, absolutely make use of both of them. But I guess the getting a paper published, as I say, is a record of your work. It's quite static once it's published, but it's got more sort of formal bounding, if you like, than something like a Life QI platform. So I think they're really complementary, but they have different function.
Thank you, Helen. And just to follow up from the offer from Health Foundation around covering the APC costs, is that just for BMJ Open Quality, or was that for any journal?
That, as far as I understand it, that's for BMJ Open Quality.
Okay. So, sorry, that was Jacinta's follow-up question, so I was just following up.
Yeah.
Has anyone else got any questions that they want to ask now at this point? No? Okay, so Helen.
Okay, great. So thinking now a bit more about that sort of set the scene, but now it's more about doing a write-up and how to get started with this. I mean, I know it is a huge amount of work. I'm not going to lie and go, oh, this is really easy. It's not. And it will take quite a lot of time and effort, and particularly it sometimes seems easier to do it all yourself, but I think we're going to see how it's useful to get other people to contribute, even though that sometimes seems like more effort. One of the things I would say is really, really helpful is keeping what we're calling an improvement journal. It doesn't have to be as formal as, you know, a special book or folder on your laptop that you keep the notes in, but do have a way of capturing the information as you go along, because it's so hard to, one, to remember it, and two, to find it when you then come to go, gosh, you know, we really need to look at writing this up now, and you're going back again a minimum of 6 months, and I should imagine for a lot of things it's, you know, more like a couple of years. So it's quite important to make sure that you have kept good records, and particularly these adjustments as you went along, because actually that's what I'm always asking people for more detail on in their reports. You know, what did you change as you went along? You didn't just go bang, 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 phase 1, phase 2, rolled it all out. You know, it never works like that. So very important to do that. Think about what is your message and why would it matter to patients and practitioners. So yes, you've done some improvement work, you know, you think there's something to learn from it, but really think about what is that message and have that in mind as you write the whole thing. And I would say read before you write. So get a bit more familiar with articles on improvement methods, how you describe those methods, look at some of the other quality improvement reports. You might think they're not very good, and therefore think about how you could write a better one. That's great. And also look at studies of similar work, whether that's improvement reports or whether it's some of the more formal research, so that in a way you're familiar with the body of work to which you are now contributing. And here's just an article I sort of recommend that people have a quick look at if they're thinking, if they want to get into this a little bit more, because as it says, it's, you know, it's a brief overview of possible study types. And if this isn't, you know, if study types and writing isn't your area, I think this is a great introduction. It's published in BMJ Quality and Safety, and it is open access. So one of the key things when we're writing is, and I think about particularly writing about quality improvement, is involve others. Really keen that people do more to involve patients and carers, the people who are presumably the beneficiaries of your improvement work. You know, would love to get more reports about how people have involved patients and carers in their quality improvement. That's still a very rare feature of the papers that we get. But also think about how to involve them in the write-up or in reviewing what you've done. And we do now require a statement on patient involvement. If you haven't been able to do that, that's fine. You can say, you know, we didn't involve patients and carers, but you need to formally state it now rather than just not mentioning it at all. The other people that's really important to involve is not to have the project lead or the project manager or whoever, but one person, or the junior, whoever, writing the report. Really important to get perspectives across the team, because people will have different perspectives, they'll remember different things, they'll place different emphasis on different parts of the work. And also, when you're thinking about the impact and how it has worked, think more broadly than the context where the work happened, about how has it had impact upstream, downstream, across other care sectors, and try to get those perspectives in as well. One of the key things we want to address is the reporting bias, that we only tend to get a write-up when something is deemed to have been successful. But of course, we can learn a huge amount, probably in many cases more, where things didn't go as planned, it didn't work as well, what seemed like a good idea proved to be more problematic. And within the reports, we get a real bias of over-focus on the results. So I get a lot of papers that really amount to, yippee, we achieved a 14% reduction of X, and lots of tables and analysis about how they can prove that it was a 14% reduction, which is fine. But as quality improvers, we really want to know a bit more about the methods that we use, the experience of implementation. So what I'm looking for is how we planned and adapted what we did to achieve this 14% reduction. And a bit, I mean, statistical analysis is important, and it gives credibility to the results. And certainly we don't want unsupported statements of success. But, you know, get a balance between these different types of content, and think about what is going to help other people to replicate your 14% reduction, and it isn't going to be your statistical analysis that's going to help them get to the same stage. Thinking about what, you know, where we learn from where things didn't go as planned, just sort of highlight a couple of Health Foundation reports, and also the sort of paper that does get published. So the paper at the bottom from Implementation Science, how collaborative are quality improvement collaboratives, looking at some work done in stroke care that sort of had some questions about, you know, whether the methodology really worked as planned. The Health Foundation report on patient flow in Wales is a really interesting study of trying to do something large scale, and how, when you've got lots of organisations working on working in an area, are they really doing the same project and applying the same methodology, or not, and does that matter? Lots of interesting questions there. And then the Skilled for Improvement report, looking at the sort of barriers that come up, and really it's a wonderfully in-depth analysis of 4 quality improvement projects, and just looking at what they had to overcome to try to get their work in place. And so I think, you know, that is a great read. Apart from anything else, you just won't feel so alone when you read that one. So thinking about credibility and replication, as I've said, too often the reports lack important details, and part of what they lack is really explaining the intervention. So because people have been working on it for a long time, I think they sort of get into a bit of a shorthand about how, you know, we were looking to improve the administration of fluids to a certain group of patients. And they just sort of just go into shorthand about, you know, we gave an educational talk to junior doctors, with nothing about what was the focus of that. And again, so, you know, people don't really understand, well, what sort of education, what sort of information do you think you need to give to junior doctors to help them understand this issue better? And without that, or sort of knowing what was the institutional context, was this in a basically in a small local hospital, a cottage hospital somewhere, or was it in a huge tertiary institution? Who were the group of staff involved? We can't really know. Is this going to be useful to me? Is it worth me trying something like this? And again, where people sort of coast through it all, and I always have a little smile to myself where people are doing an IT intervention or changing something in their automated system, their electronic patient record, and it says in one line, you know, we identified 3 changes to be brought into the patient for the EPR, and basically, you know, it's like they spoke to someone in IT and that happened. And I always just think, like, no, I don't think that is just how it happened. I think there was more to it than that. And we really need to know, you know, how have you negotiated with the IT department to get in 3 changes that you want in your department, and this is a hospital-wide system, or what, you know, really need to talk about those challenges and where, you know, and how you have worked within organisational structures or circumvented structures or whatever you've needed to do, because without that it just doesn't seem credible, and it's not really speaking to people who are battling in this world and sort of know what it's like. So if we now have a look at what I call a typical QI report, obviously this is just sort of very brief, but something around hospital falls, bit of background to it. What's the problem? Part of the problem is that staff don't risk assess. They've implemented a multifaceted strategy, briefly stated design, data collection. Might mention that they did PDSA, got this focus on the results. Falls have been reduced by 27%, and then the discussion shows that patient and care empowerment can be effective. Now, obviously, you get, you know, that might take up sort of 20 pages. but that is basically what people have told us about what they've done. And there's quite a lot missing. So they've identified that part of the issue and the reasons behind the hospital falls are this failure to do risk assessments or implement controls consistently. But we don't have enough detail in their multifaceted strategy to know how was the staff education, the clinical champions, or empowering patients linked to risk assessment for falls or implementing the controls. So we have this sort of disconnected narrative where there's no connection really between the detail of the issue that people were trying to improve and an explanation of, rather than just a method of staff education, as I say, something about what was in that staff education, how was it delivered, how did staff react, and so on. So we're missing key features that would help us know how we were likely to do something similar and achieve a similar result of 27% reduction. So what we'd really like to know is a bit more about the commonly identified problems that can lead to hospital falls. So really be specific about those factors, and then in your methods, really explain, when you explain what you did, how did these facets of the education, having clinical champions and working with patients, how did you address those particular factors by doing X, Y, and Z, and sort of making explicit what those ingredients were. And this is where we really start to have an explicit and spelt out theory for the intervention, because we've said exactly what it is we were trying to tackle and what the elements were, what our multifaceted elements were, with detail about how they were intended to address the components of the problem. And that's what people need to know if they're going to be able to do anything with it. The methods, the methods are so rarely clear about what people did. And I find one of my most frequent comments back to people is that they've said, in PDSA 1 we did this, and in PDSA 2 we did this, and there's actually no link between PDSA cycle 1 and PDSA cycle 2. They are, in actual fact, they are planned phases for the quality improvement intervention and the implementation of that. They're the planned phases that people are going to do. They're not, PDSA is about how you make a small change and assess that change and then make adjustments to your intervention in response to what your measurement tells you about that. And very often people are claiming that they've used PDSA when in actual fact they haven't. Now, if they haven't, that's fine. I think they put a lot of emphasis on PDSA, but it doesn't mean it's the only way to do quality improvement or it's the only way to write up about quality improvement. And if you haven't used it, that's fine. Just say what your method was and how you did plan your phases for implementation, but I'd say don't label it as PDSA if it wasn't. And if you did do PDSA cycles, we need to, it's a bit, it seems a bit plodding, but it really helps people to understand. You really need to set out, what did you plan? How did you implement that? What did you measure and what were your measurement results? And how did you adjust the intervention in response to those measurements? And that is how you would report a PDSA cycle. And we need some discussion about, studying what you did, the so what factor of how you think this worked and what your results mean. And therefore, if you're going to say that patient and carer empowerment can be effective, you need to discuss that in your paper and how that came about, and particularly, do try to include some views from patients, some reports, some feedback from patients in that, if you're claiming that it was a study, an intervention that involved and was aiming for patient empowerment. So here we have a slightly better approach where we say that, after the first round of staff education, what was reported, the timing of the sessions wasn't right and people didn't really like the material. They wanted some different sort of materials. So that obviously gives much more detail and helps somebody reading the report can then actually, they can start from a better place, have a bit more thought about the timing for their training, and also It doesn't mean they say they definitely need to do more visual material, but again, maybe they would want to then check out with people before they planned all their training materials what people would find most useful. So reports on improvement, you know, the point is the results are important, but they're not the only thing. And we do need these other elements as well. Really keen to know how did people design it, you know, and this explicit theory of why did you think your design was the way to tackle the issue that you'd identified. We need to know about the setting, the context, explain what the components were. I think measures and data are usually quite well expressed, but definitely don't lose that. By putting in these other things, don't lose your measures and data. Really keen to know about the challenges and how you overcame them. And some of the discussion to focus on what the team would do differently for the future is a useful thing. And the other thing that not mentioned on the slide here is also, we're often getting reports of things that have been run as a project, and it's really important to know about what's the sustainability of that. What have you learned to date? You're probably writing this up about, you know, 3 to 6 months after, at least after your project is finished. So really do a bit of a catch up and tell us what, you know, has it sustained since you stopped actually the active implementation phase, and what do you think has affected that? I'm going to plough on now in the issue in the light of I've got material I want to share with you, but I think it's all on the same theme, and we'll quickly do this. So I've sort of said about, you know, how to structure the report and some of the things we need to do, and help is at hand in the form of the Squire Guidelines, the Standards for Quality Improvement Reporting Excellence, which are available online. Just Google Squire Guidelines and it'll come straight up. And this has been put together by really experienced researchers and improvers. It's been in use. It was first introduced in the early 2000s, and it was in 2008, and then the revised edition came out in around 2013, and it's been tested and well used. It's got it sort of sets out a framework for you with the notes about what you need to include in each bit. That's all available on the website, but it's basically around these 4 fundamental questions, which in a way are the simple way of saying what I've just spent the last 10 minutes talking about. But that is really the structure, the whole why, what did you do? Why did you do it? What did you find? And this very important one, which often gets a bit overlooked, what does it mean? And a little bit more detail there. So it's, you know, and that sort of fits into the 4 sections of the introduction, methods, results, and discussion. So I won't read out what the bullet points there, but it's, you know, it's just a really quite a simple checklist. You may find that you don't need to fully slavishly follow everything that's in the Squire Guidelines. It's a guidelines, it's a format to try, but I think it's a really helpful way to start organising your material. And, you know, certainly for BMJ Open Quality, we encourage people to use this format, and in a way we sort of have a sigh of relief when we open the folder and find that the paper has been written in this way, because we know we're then more confident that it will have the elements that we're looking for. And I would sort of say, when you come to submit, you know, you've done all that work on the sections of the Squire Guidelines and you've got your paper. The thing not to neglect is the abstract. It's what we see first, and if it doesn't look impressive, I wouldn't say I ever just reject on the abstract without looking at it. But if it's given a poor impression, you're sort of thinking, you know, this looks a bit scrabbled together, or I don't think they've really covered the key points here. So I'd say don't rush it, review and fine tune. And really sort of make that interesting. I think it's going back to the first point, what's your key message for practitioners and patients, and make sure you've captured that in the abstract. I'm going to pause there. I know we're a bit short on time, but pause for some questions there before I would then go on to the publishing process, and then I've actually even got a message on how to spread your work more widely.
Brilliant, thank you, Helen. So we've had a couple of questions in. We have one from Louise Walters. Are you, Louise, can you join us? Can you to ask your question, or do you want me to ask on your behalf? Okay, so Lou had a question around how to select the best or the most appropriate journal for your quality improvement project. So say, for example, if you're working in a particular speciality, I think the unfortunately all the comments have dropped off, but I think it was maternity, for example. How would maternities specific journals welcome quality improvement projects like this, or I think
well, some would. I think you need to sort of look first of all, sort of look to see what are their criteria for papers. If it is purely a clinical research journal, they're very focused on clinical research, then I think they're unlikely to look at quality improvement. If they're more broadly a journal for people working in that field, you see what I mean, a journal for practitioners covering more general issues about that health sector, then I think they are getting more interested in quality improvement.
Brilliant, thank you. So again, it's going back to your tips at the beginning around looking at what they've published before, maybe, as well as the current direction. And then Claire Morrison has also asked a question around the process of submission. So Claire, are you happy to ask the question?
Yeah, can you hear me?
Just about. Hi. Yeah, that's better, thank you.
So my question was really around, I suppose, the barriers to submitting something. So you touched already on the fact that it's time consuming, and it is incredibly time consuming. And I think for people who aren't academics, that is a challenge. But what I found most difficult was really the kind of the language that you have to use to submit, and the way it has to be set out. And there was a lot of terminology and requirements to do things in certain ways that I just couldn't make sense of it. So I ended up finding a friendly academic who helped me through that process. But I just wonder, is it possible to make publishing more accessible to non-academics by taking out some of that language and enabling us just to write in normal English?
I definitely want papers in normal English for BMJ Open Quality. And that again, that's very common comment back. I mean, it is a different sort of journal. It's for a different audience. You know, I'm not looking for this to talk to particularly to researchers and not to clinical researchers. So I want the papers in plain English. So I think.
So it's things like, I suppose, the submission document, for example, if it's set out in a way that isn't so repetitive and isn't so in a requirement that it's the way that the terminology kind of asks you to do different things, that it is a barrier if you're not used to academic type publishing. So it's how it can be made into a template that's easy to understand for those of us who just haven't got academic experience.
To be honest, because I'm not familiar with other journals, I can't speak for what their submission process is. I mean, we do need to have, because it's all automated. I mean, it's certain. I don't think there's any way we can get away with things being repetitious, with things needing to be sort of added in certain points on the submission thing, because that's how it's automated and that's how different things then populate the system. And if we didn't have the automation, I mean, we just couldn't possibly deal with the volume of papers. Okay. If you don't mind, I'm going to carry on, if that's okay.
Yeah. Yeah.
Okay, because I think I might sort of be covering this. So, I mean, this is all tips for submission, just going on to. And so I'm saying write in plain English. Don't have those Latin tags, and really, particularly, I mean, BMJ Open Quality is an international journal. Don't use NHS jargon, which I think people forget how much it is. Look at all the way. Every journal will have a website with policies and advice for authors, looking for this meaningful patient involvement. And to share, I mean, it is quite technical what goes in the supplementary files. You do need to have your conflict of interest statements and your ethical statement. I think that is just part of academic publishing and having a credible journal. But it's, I guess, yeah, I mean, get somebody who's more used to doing it to work through it with you. And, you know, we're quite forgiving. We do sort of say, oh, you know, just change this bit. So what happens after you submit it comes to editorial review. There are some papers that we just decide that they're very poor quality, or it's, and when I say poor quality, I mean things that are incoherent, things where there doesn't seem to be a link between what's described and the results that are presented. But we have a high acceptance rate, so there's only a few papers that I just, or it's not suitable. Sometimes I get papers that really aren't about quality improvement. They are about more sort of clinical therapy changes, in which case that's not for us. That does need to go into a more clinical journal. But if it looks good, really I think it's interesting, yes, it's our territory, it goes out to peer review, and we get the peer reviewers come back with their comments, they read the papers, they have guidance on what we're looking for, you know, these coherent, useful quality improvement reports. They come back with their comments, and we usually go through, unless again the peer reviewers may decide that it's not of sufficient quality, or they couldn't understand it when they looked into it in more detail, so a peer reviewer may give a reject decision. But usually they come back and they have comments for minor or major revisions, and then we go round a cycle of revised version 1 or 2 times. Sometimes if people can't get to grips with doing the revisions, they maybe haven't got the additional information that the reviewers are asking for, or, you know, there is a flaw in the paper that, you know, wasn't apparent on first reading, you know, that may still be rejected after revisions. But we obviously try to avoid that. We don't want to ask people to do extra work and then reject the paper, but it may go through a couple of cycles of revision before we get to publication. And I have to say, unfortunately, the peer review process, we have great difficulty getting people to accept the peer reviews, and it's all done on a voluntary basis, and this is where the long time delay does come in as we're waiting for people to submit their peer reviews. So whilst you've got a lovely little diagram here with the arrows and things cycling round, I'm afraid you do have to sort of add a bit of a time scale to that. But the peer reviewers are really crucial, and again, if anybody would be interested in doing peer review, always looking for more peer reviewers, and from people who are active in quality improvement, who are experienced improvers, who don't need to be an academic or a researcher to do peer review for BMJ Open Quality, because, you know, who are the peers of the quality improvers? They are the people doing quality improvement. So the peer reviewers are looking to the relationship of the work to existing evidence, which means, you know, are people aware of the field? What do their references look like? Do they know the key papers and the key pieces of work that have been done in this area? And also the peer reviewer is looking to see, you know, how does this link to my experience of doing quality improvement? Do I think this is an adequate description of a PDSA cycle, for example? Am I clear what this measurement is? And so the peer reviewers need to be objective. We do ask people to highlight conflicts of interest, but that's not really, you may know the people, you may know something of the work. That doesn't mean to say that you can't peer review it, just that you need to state that you're aware of it, and that you're giving it an objective review. The only people where it's a real conflict of interest is if you've actually been involved in the project yourself. And we want peer reviewers to frame, they're not just giving a critical, oh, this is wrong, that's wrong. Their comments are to help the authors improve the paper. And so just saying that something, you know, I didn't like the way you presented your information in table 2 is not really very helpful. We want the peer reviewer to say, how can table 2 be improved? What does it need, you know, what's the improvement? And we really, as an editor and with the associate editors, we really rely on the peer review comments to help us sort of make our decisions about what's going to go through for publication. And so, as I say, as an open access journal, we don't have, not like a paper journal, we have not actually limited in the number of papers we can print. We're looking to be sort of encouraging and get papers through, but it does need to be the right fit for our journal. We're looking for this coherent, well-written narrative. When you get the peer review comments, we are looking for those to be addressed. Or to explain why you disagree with the peer reviewer, which may be quite legitimate. They may have not quite understood what you were saying, but in that case, you may need to think about how to make it clearer, or they may have a very fixed idea about how such a project should be run, and that does happen, and you can then explain why, you know, you don't agree with their view, but it needs to be worked through. Where we can't then accept a paper for publication is if they've basically just ignored what peer reviewers have said. We need to have either, oh, thank you for this comment, yes, we've corrected it and this is what we've done, or no, we disagree that this needs to happen and this is the reason why. But you must work through those comments or else it will be a reject decision. You know, we're looking for things that add to the field. I don't tend to reject things just because it's something that's done before, but obviously if we had a lot of papers on a particular subject and something comes along that's really just a duplicate of something we've just published, then I'd want to screen that. I'd want to screen that out straight away, not for it to go through peer review. And what we're really looking for is what is going to be useful to practitioners, what's adding to the information here, and helping people do improvement better. And certainly where we don't feel that it's novelty is not so important to us, and certainly for any research journal it does have to be original, not so much for open quality, but really does have to have interest and relevance, and it can't just be a sort of a plod through of something that's been done hundreds of times before. You need to be adding something from your experience to it. Sometimes, particularly where it's an original research paper, if the study design isn't appropriate for the work that's been done, that will get, you know, a poor review, and obviously that's not something you can change in just making revisions to the paper, so that would be a rejection. Sometimes if things are very, very niche, I mean, most work can be generalized and there are lessons there for other people, but if it's something really, really niche, then and I don't see that it's generalizable to other areas of quality improvement, I will advise that people go to a journal in that particular sector, and often reviewers will reject when they find that the statistical analysis is incomplete or not appropriately done. So these are some of the sort of key reasons for rejections. Some of them can be fixed. So although we might have some of these are also where we get a major revision, but something like the study design or statistics, which have been often, it's dependent on the data that you've got, what you can do with the statistics, and then if they're not sufficient to really support your findings, then unfortunately that would be a reject decision. And I think some of the ones that I reject are where there's over interpretation of results, where people have done something which actually was a very small quality improvement project with a small sample, and then, you know, are making a big claim about that, how that can improve care for patients on a much wider scale, and it really isn't supported by the scale of the work. So I think that's something, is to be realistic and address that sort of thing in your limitations comments, that you are aware you had a small sample, you are aware that for this to be you know, taken further, it needs to be applied more widely, and then, you know, that's fine, because it shows an awareness of the work and not over-claiming on those results. So there are some pros and cons to academic publication, and you need to think about that, which I know we're running over time now, and I'm just going to run through thinking, if you don't think that academic publication is really going to get you to the audience you need, there are lots of other ways. And, you know, there's wider dissemination, and I'll plug the Health Foundation's toolkit here, which gives you lots of information on how to look more widely, and using social media, using blogs, using presentations, conferences, and it's just about identifying who you want to reach. You know, where are they, where do they go, where do they get their information? And, you know, it may not be through journals, so think about presenting at conferences and seminars. Where does it fit? Tell an engaging story. Lots of people are really disappointed when they think, oh, I've only got a poster, but actually that's a great opportunity to share your work. You can quite easily make a poster stand out, because most of them are quite boringly presented. There's somebody's PowerPoint slides they've just stitched together. So if you think about it being a visual communication method, put some effort into the design, you will get attention at a conference, and then be there to talk to people as they come round. Best practice awards can seem a bit cheesy, but they are a way of getting your work noticed, and they're tremendous for boosting your credibility in your organisation. If you get shortlisted for HSJ or BMJ awards, but the judges are looking for clear results. What were the benefits? And I think here you really do need to show that you've done something original. That's what catches people's eyes. So much easier these days to do visual, audio and online work. You know, you've got the picture here with the camera. I mean, you can do it on your smartphone. You need to think about where you're going to post it though. So this is where you need to match up. You've got your outputs and what are the places that need relevant content. But all these organisations, all the sort of patient communities, charity organisations around the condition, professional associations, they're all looking for content and you can help provide it. So there we are.
Thank you, Helen. That was fantastic, a wealth of information, really great to get all your insights, and thank you for signposting to all the resources and tools. And actually in the chat function we've also had other resources and tools flagged, so that's been brilliant. So things like Open Athens, also an event Matthew flagged, so you can look at the chat and look at the links for that, but also questions around how to join Q, because obviously I think the offer of covering some of the costs of open access is going to be a good incentive. So that's all in the chat. Thanks for your top tips. We will share the slides. I'm really conscious we're over time and I actually have another meeting to go to, so I'm really sorry. What I will do is I will keep hold of the chat. If you've got any questions, please, that weren't answered today, please put them in there and we will. Helen, is that okay if we try?
Yeah, absolutely. No, happy to email back on questions, no problem.
Yeah, and because we've got really good questions around the fact that it's difficult sometimes to get qualitative research published. There seems to be a bit of an emphasis on quantitative.
There is, yeah. That does continue in some of the major journals, but I think again it's looking at the venue and looking outside of the clinical research journals to some of the other types of research, sort of social medicine, medical sociology type journals, management journals.
Yeah, brilliant. Yeah, so sorry we didn't get a chance to talk today, but I didn't want to stop the amazing information that was being shared, so thank you. And we will send everything around, so thanks everyone. Have a massive thank you to Helen for doing that, really useful. Goodbye, thank you.
Thank you, it's been a pleasure.
I want to do a round of applause. How do you do a round of applause on Zoom? Can we do, maybe it's a big wave, hand waving. But thank you everyone, and particularly Helen. Thank you.
Thank you.